Welcome to Senior Living Visionaries, a podcast for senior living leaders who are looking to stay ahead of the curve in the industry. On this show, we feature leaders and innovators in senior living who are pushing the boundaries and creating new, effective services and solutions. And now let's settle in as host Jennifer Drago connects us with today's guest.
Welcome to Senior Living Visionaries, where we showcase the leaders and innovators who are shaping the future of senior living. I'm your host, Jennifer Drago, strategy consultant and CEO of Peak to Profit. And today my guest is Bob Roth, who is the managing partner of Cypress HomeCare Solutions. I've known Bob for many, many years. He assisted in creating Cypress HomeCare Solutions with his family in 1994. So this is the 30th year? 30th year. That's amazing. That's awesome. So Bob has nearly 40 years of consumer product experience, healthcare, and technology experience. And so he's brought all those together to raise the depth and breadth of his experience to the home care trade. And in doing so, Cypress HomeCare Solutions has been honored to receive a number of awards over the years. I'm not going to read them all, Bob, but if you want to highlight the most recent, that would be great.
I think the one that I cherish the most is the Better Business Bureau.
Mm-hmm.
And the Better Business Bureau has a Torch Awards for Business Ethics.
Mm-hmm.
And they require you to enter only every 5 years after you've won. Mm-hmm. So we have been bestowed the honor of winning in 2013, 2018, and we're finalists in 2024. We're the only home care company that's ever been nominated, let alone win. And if we win this year, there's only one other healthcare related company for the Better Business Bureau chapter here that has won it, and that was Hospice of the Valley 3 times.
Another great organization.
We would be in great company.
That's right.
I would love to take that one down. So
perfect.
That's an award I cherish a lot.
Thank you for bringing that up. I appreciate that, and I agree. That's amazing. In addition to all the work that he does in the home care space and leading his company, he hosts a radio show and podcast called Health Futures, Taking Stock in You. And that program airs every Friday from noon to 1 on Money Radio 1510 AM and 105.3 FM. That's in the Phoenix area. And you also write a monthly column called Aging Today for the Jewish News of Greater Phoenix and for Love and Life After 50 newspapers. And, so what I'm trying to get across here is that Bob is a thought leader in our industry, in the senior care industry. And I am so excited to have you here, Bob, specifically because I want to talk about trends in home care and caregivers and all the challenges we're having today that may get worse in the future. But why don't we just pause for a second and let you tell us about Cypress, if you would.
My journey really began in 1985, January 2nd. My mother suffered a major heart attack and never was quite the same. Spent 2 months in the hospital, 18 days in a coma, and came out a very different person. And we, meaning my brothers and I, along with my father, we were accidental caregivers. Mm-hmm. We didn't really know what that was all about. Back in 1985, there were no home care companies, nor was there the concept of assisted living. It wasn't even born yet. Wow. For us as a family, we found ourselves as caregivers. My brother came home from school, spent a year caring for my mother, and my folks moved from Baltimore to here because the climate was a lot better. We stood up a home care company April 28th, 1994, to provide in-home supportive care services for our aging population right here in the Phoenix metropolitan area. We were one of 10 home care companies back then. The other 9 are gone. They either got acquired or went out of business.
Wow.
And now there are over 700 here in Maricopa County with many franchises that weren't even around back then. Home Instead started almost exactly the same time we did. They were the first well-known franchise in the home care space.
Yeah.
So that's really my journey to this. My brother Joe ran the company for 10 years. He decided to do something else in terms of his work life, and I was given the honor of taking over. And I will tell you, truth be told, I did not want it. Did not want to get into this business. I loved consumer products. I told my dad that, at the time I was doing some consulting, I said I would do both. And literally after 2 months, I said to him I couldn't do it. And he was upset because he thought I was going to escape out of Cypress. And I said, no, I'm going to give up my consulting client. I got to go full time here. Oh. And I've never looked back.
Yeah.
It's been 20 years at the helm. And Oh gosh, you and I go back a long way and a lot has changed.
Yes, yes, for sure. In many states, home care services are regulated, just like a lot of healthcare services. In Arizona, home care agencies are not regulated. There is no state licensure for them. And so Bob and others leading the industry in our area took it upon themselves to create standards that they all agreed to abide by in the Arizona area. And so, Bob, I'm thankful to you for that leadership, because it made our customers safer, at least the customers that chose the agencies that agreed to those standards. And I'm still shocked today that we don't have licensure for those agencies.
Thank
Anything?
you for remembering that.
Yeah.
I spent a lot of time, it started in 2007, and in 2015, Governor Doug Ducey signed into law this disclosure rule. It's not
Mm,
perfect by any means, but to get that was really a monumental task.
right.
I learned a lot about the legislature. Wow. And, we had a lobbyist that told me back in 2007, it takes several sessions to get a good bill done.
Yep.
Don't lose hope. So that summer, 2014, me and two of my colleagues, we went down 4 different times and we ended up getting passed that disclosure bill.
So Bob, I know you're highly connected in the world of home care. I know you attend a lot of trade conferences, you speak at a lot of them. I see you post on LinkedIn. Of course, you're writing about it, you're talking about it on your podcast. And I love that you're always willing to share your expertise in this area. There's a lot going on right now, a lot of trends that are shifting and moving in some not so positive ways. Or maybe you'll have some positive news for us. But tell me, what are the trends that senior living providers should be aware of related to home care staffing and just home care services in general?
We'd be remiss if we didn't talk about the headwinds. The headwinds are really strong. And I'm specifically talking about the headwinds relative to workforce.
Mm-hmm.
I will tell you this. Immigration should not be a dirty word.
Mm-hmm.
We have some incredible caring nations out there. And you and I know the ones that are really permeating through our communities. And that is these homes that are owned by Romanians and Filipinos. They don't get any better than that.
Mm-hmm.
Culturally, they're wired and geared to do that.
Yeah.
And then you have West Indies, you've got Ghanans, you've got Tongans, you've got so many caring cultures out there. We have to figure out how we can open up the visas
Mm-hmm.
and allow them to come in. Do you know in Canada, they have 8-year visas? I just learned that the other day. I
Wow.
mean, you can't even get 25% of that here. We have to figure out how to open up our borders legally and bring in these caring nations to help care for us. I mean, I think first and foremost, that has to happen.
Mm-hmm.
Otherwise, we're just going to continue to spiral down into this abyss that none of us ever want to be in.
Right.
The other thing about the workforce is that, we need to figure out how to engage and empower our younger kids, the kids that are coming up. We need to give them the soft skills. And I know before COVID, the Arizona Department of Education had at least 50 high schools throughout the country or throughout the state that were doing direct care workforce training, where they were teaching them direct care workforce curriculum that we use in the access world for all techs work. And that was a 2-year course, which I think is amazing. But the other part on the workforce is the wages. We're talking about people that are making a livable wage. So we're talking about food service workers, housekeepers, caregivers. We, across the board, have had to increase our wages between 40 to 50%. And the unintended consequence is that the cost of our services are going up. And as a result of the cost of our services going up, by the way, that's the second headwind, is the cost of our services are going up. So they're going up for me in home care. They're going up for a lot of people that you work with and work for in the senior living world. And guess what? The consumer, which is usually an older adult, is living on a fixed income and now is looking at costs that could be as high as 40 to 50% more.
Yeah.
So, the conundrum that we have is how do we figure this thing out where we can provide enough care for people that we're not breaking them financially and emotionally, but being able to give them the opportunity to live out their lives in the setting that they most want to be. Home is usually the preferred,
Mm-hmm.
but it's not for everybody.
Right.
And in home care, we had two things that happened. Back in 2015, we had repealed, and it was a law that was put into place in 1974. It was part of the Fair Labor Standards Act
Mm-hmm.
that allowed consumers not to have to pay for overtime for workers.
Mm-hmm.
It was called the companion exemption rule.
Mm-hmm.
And workers that were working with the elderly or working with young children were exempt from having to be paid overtime.
Mm-hmm.
And that was in effect since 1974. And in 2015 or 2014, President Obama had the Department of Labor withdraw that.
Mm-hmm.
And as a result, many of the care workers across the country did not have a problem with not making overtime. They wanted the hours.
Right.
They loved the work that they did. They weren't complaining. Well, many of them weren't getting the hours anymore because we were being stifled
Mm-hmm.
in terms of home care because we couldn't pay or we had to pay overtime. And again, going back to the consumer only has so much discretionary dollars.
Right.
And they weren't able to pay for the amount of care when overtime was coming on. And now they were stuck with having multiple caregivers coming in their home rather than the one that they had before. But we estimate about 15 to 20% of our workforce across the country went underground.
Mm.
What do I mean underground? They're
Paid out.
Craigslist.
Yeah.
They're knocking on doors. They're working privately.
Yeah.
The second thing that happened to our workforce was COVID. So in 2020, our state, as well as the federal government, decided to give unemployment dollars out
Mm-hmm.
during the time that we were in COVID. And the unemployment amount that was given for the state as well as the federal government gave employees that are used to getting $13 to $14 an hour. Some were getting $15 an hour back then. Now we were giving them $21 to $22 an hour to stay at home.
To stay home.
Stay home. So they stayed at home. And guess what? Caregivers don't stay at home.
Yeah.
They were working.
Yeah.
And rightfully so.
Mm-hmm.
Because older adults needed help.
Mm-hmm.
But what did they do? They tried on the whole private care world. And guess what? They liked it. They liked it enough that they never came back either.
Yep.
So but those two pivotal events that happened in 2014, 2015, and in 2020, it totally gutted our workforce by 20 to 30%. And I get the feeling that senior living probably went through a very similar situation.
Oh, absolutely. Yeah. And yeah, we were gutted in so many ways, and including occupancy, right? People didn't even want to be in congregate living settings. So the other thing, go ahead.
So I just want to say, those are headwinds. The tailwinds, need.
Yeah.
And that's a whole separate podcast too. We can talk about how the growing need is there.
Yeah.
There's never been a better time to be in this space right now than now.
Yeah.
Because there is so much need. We just have to figure out how to do it.
How to manage it all. I agree with you. And we were just talking about that as we came on the show too. The other thing I just wanted to mention, we were talking about the affordability of home care services for the consumer. And, again, we are, as folks deteriorate into a situation where they need care in their home or they need to move to a community in order to get that care, they are faced with often a surprise to learn that Medicare doesn't pay for these services. For the most part, I guess Medicare Advantage is starting to pick up, a certain number of hours.
And if I can just chime in, those hours have never been authorized more than 100 hours per member per year.
Yeah, I mean, really little.
Usually in the 40 to 60, it's more of a transitionary care.
Yeah. So if you were
coming from a hospital or a step-down unit home, needs care maybe for the first 2 weeks, and that makes sense.
Yeah, and I applaud that. I think that's positive. But we have this affordability issue that you referenced, and I had Lisa McCracken on the show a couple of months ago. She's from the National Investment Center for Senior Housing and Care, and Nick does a lot of research in this area. They did a joint study with the Harvard, I'm going to get their name wrong. It was a Harvard Center of Research, and it was about the dual burden of housing and care. So here you have seniors who want to stay at home, and they are maintaining the cost of their home, and then they need care. And so what they found in this study, and it was city dependent, it was geographically dependent, but in many areas, by the time you have your housing costs and you pay for the care in the house, it's actually less expensive to move to assisted living. And so it's kind of interesting that that dynamic has happened, because a lot of people also assume, one, after they realize Medicare doesn't pay for this, but they usually assume it's going to be cheaper for me to stay home and receive that care. And that's not necessarily the case anymore. In fact, my mother-in-law is in assisted living right now. There's no way we could afford the amount of care that she's getting in assisted living in an apartment or in her own home. So just something else to add.
I'll chime in and tell you that the tipping point really happened about 5 or 6 years ago. I've been doing this now for 20. My family's been doing it for 30 years. And I'm going to tell you, for the first, let's call it 15 years, we, meaning home care, was the more economical solution for consumers. It just made much more sense for you to stay at home.
Yeah.
To get 24/7 care today from an in-home supportive care service company like Cypress or anyone else, you have to be prepared to spend $350,000 after tax. Yeah. That's 24/7.
Yeah.
Now you can do the math. So if it's half of that, 12 hours a day, then you're looking at $175,000. So I mean, look, it's expensive.
Yeah, for sure. Well, let's start talking about some of the solutions that we've seen that are maybe promising in addressing all these really depressing things that we've been talking about so far. So I've been pleased to see some of the folks that I've been interviewing really work together. Senior living providers work together on innovative recruitment strategies. We mentioned maybe training programs and things like that. What have you seen in the senior care industry, or how can we all work together better to address the shortage of healthcare workers?
Well, there's a number of ways, and I want to take this in two parts. Okay, so first, it's embracing workforce automation, artificial intelligence, using machine learning, and that may be another term people are accustomed to seeing, and using that for workflow. Okay. And what do I mean by workflow? I can tell you in home care, the world has changed since the pandemic. Caregivers aren't coming to the office anymore. If you want to hire somebody, you got to meet them where they're at. And we don't have a whole lot of them. I mean, I'll talk about a little bit later how there's just not enough people behind this group today to take care of us. So knowing that, we have had to go to them. And we've been going to public libraries, Starbucks, restaurants. We've been meeting them where they're at. And even though we've embraced early on automation, where we were sending text messages the day before, the morning before, an hour before, and they'd have to acknowledge them, we were still getting 20 to 30% no-call, no-shows.
Wow.
And we were putting our people out into the field, paying for their time, their drive time. So we were with this conundrum. It's like, okay, from a workforce standpoint, workflow standpoint, how do we improve this? So we've engaged a couple companies. One, we have a recruiting platform that is robust. We're up on 18 different job boards. And we're changing the ad almost every day, because you have to be dynamic. You can't be static. Otherwise, you're not going to rise to the top. You got to keep it fresh. Second of all, when we get an applicant coming in, we're now doing digital interviews, like you and I are right on Zoom. I want to get a sense of, who am I talking to? What do they look like? How do they speak? Is English something that they can speak? Because 98%, 99% of my clients speak English, and I need someone that can speak clearly. Those interviews are set up for 15 minutes, and I don't have to tell you, in the first 3 to 5 minutes, maybe 2 minutes, we can see if this is somebody that could be one for us. I mean, literally, the first 15 seconds are crucial, right?
Right.
It's how do they make their first appearance? How do they represent themselves?
Yeah, got it.
So if they get past that, then they get sent a link, and they fill out a more complete application, and they're uploading all the certifications, all the documents. I mean, look, this society that we're employing now understands technology.
Yep.
And it used to, from a workflow standpoint, it used to take my team so much time to scan all the stuff in, and then, rekey in the application. We got them filling out the application. That application, went into my enterprise software solution. We're utilizing automation and technology to really improve workflow so that we can get caregivers onboarded. We're working on getting them on board within 3 to 4 days. And I think we're almost there from the time of initial engagement to get them on board and out there working. Listen, caregivers are special. They have a gift of caring, and every one of them is like a snowflake. Every one of them is very different, but every one of them has heart, and they express themselves in very different ways.
Yeah. They
are the key to any home care company, any senior living community success is that caregiver, that person who's providing the care.
100%. Do you use any special tools to help? I know one of the most challenging things in scheduling caregivers and that kind of care is this person needs 4 hours, this person needs 12 hours. Oh, somebody just came out of the hospital, they need 24-hour care. And so the schedule is always a moving target. Do you use any kind of technology to help? I always used to say the people who scheduled those, they were worth their weight in gold if they did it well, because it was the key to your productivity. So I'm wondering, are there any tools out there that help you do that?
Well, the enterprise software solution that we just went to, it's called Access Care. You probably wouldn't know them, but they're in the home care vertical. They were born out of a franchise group of 6 franchisees. They created their own software. So really a lot of the machine learning in the background does the cogitation and review. So if Tracy or Renee, who are my primary care coordinators, go out, and they assess a case, they do a home safety evaluation, they put a care plan together, they do a service agreement, and they upload it to the cloud. It goes into our Access Care database. And our scheduler takes that because we know what the schedule that they need, and it will determine which caregivers have the availability, which ones are in the close geographical area, and which ones are meeting the criteria of need of that client's need. So, we have presently close to 200 caregivers on our platform. So 3 or 4 may bubble up. So now we have options. Now we can do it old school. Now that, we didn't have to go through the list because the machine did the work. Now we know the 3 or 4. We can talk about the 3 or 4. When I say we, it's not me. It's Renee or Tracy, our care coordinators and our schedulers, to determine who do we think is going to be a good fit. So automation is really big on the workflow side. And I would imagine it's the same in the senior living. And I'm imparting to you and everyone that is listening to this, embrace this, because if you don't, you're going to be left behind. You're going to be left behind because for us, we have to work on smaller margins. And if I can take some of that burden away, and I'm talking about those FTEs that were used to be able to onboard caregivers, and if I'm able to eliminate 1.5, or 2 FTEs, that's bottom line saving.
I just want to make one quick comment about Access Care, and there's other solutions out there. I actually implemented Access Care in 2 continuing care at home programs in the last year. And so my message to senior living providers, if they're listening to this, is when I worked in senior living, we actually had caregivers that we employed, and we were trying to use our existing, I'm going to call it an EHR, to schedule and document with those caregivers. It was not the right solution. So we were putting square pegs in round holes because it was something we already owned. And in that same provider, we had a continuing care at home program. We did the same thing with the continuing care. We had lots of workarounds and trying to make this program work. If you employ caregivers, look at the products that work well for your caregivers, because again, the scheduling and that whole productivity thing is so key to keeping your costs low. And yeah, I think we should do better in senior living in picking the right solution and not trying to always force into the solutions that we just happen to have on the table.
100%. So I'll talk about the delivery using technology.
Okay.
All right. So in the home, and I can tell you about what we're doing at Cypress. And at Cypress, we're trying to reimagine home care in a very different way. And, we are at such an inflection point in time. And you and I talked about this before the show started. I mean, to think that, Dr. Ken Dykewell wrote the book Age Wave back in the mid 80s, talking about this. That was 40 years ago, predicting this. And now it's all happening around us. It's just absolutely crazy.
It is.
And it's crazy that our lawmakers keep kicking the can down the road. And And on the Medicaid side, which I'm a Medicaid provider, since 2011, they've been underfunding us for the reimbursement that we are receiving for the work that we do. They don't even keep up with minimum wage. I can't find caregivers really for less than $20 anymore. And, it's really, really hard to find workers to, do this type of work. So, here we are, we're at this point where the cost of our services are really high. We have to figure out how we can figure out a wraparound service to protect those people in their home.
Mm-hmm.
In order to innovate, you have to collaborate.
Mm-hmm.
And we have a couple collaboration partners, and one of them was at the most recent Arizona Leading Age Conference, and that was Sensi AI. Sensi AI is a company that created I call it a virtual care assistant using acoustic sound to discern changes in patterns, and it is using artificial intelligence. So it's a wraparound service that we can offer clients,
Mm-hmm.
where, they're concerned about their mom and dad, or they're concerned about, grandma and grandpa, or whoever they're concerned about. We can install those in their home.
Mm-hmm.
Typically it's 3 units, and each unit's like a Blade air freshener. You just plug it into the plug.
Mm-hmm.
And it has the ability to start tracking. And it used to be, the older models used to take 3 to 4 weeks. Now they've got it down between a week or 2 to establish patterns.
Wow.
And I think you understand artificial intelligence, it's all based on patterns.
Right.
And when we get the alerts is when there's a change in patterns.
Mm-hmm.
So the only thing that it can pick up immediately, because it has an acoustic ability to it, it's listening. And it's not breaking any privacy laws. It is only listening for specific things like help,
Mm-hmm.
I've fallen.
Yeah.
So, we will get those alerts. I mean, to give you an example, Jennifer, I had a client that was over at the Sagewood, and I know the son, and we had this client for about 6.5 years. We presented Sensi to him. And he said, you know what, mom's got a PERS system. And for anyone that's listening doesn't know what PERS is, it's the personal emergency response systems. Those are those buttons, help I've fallen. It's either on the wrist or on the neck. He says, mom's got that. I'm good. We're okay. So literally less than a month later, my caregiver came in. My caregiver worked Monday, Wednesday, Friday, 4 hours a day. So came in on Friday morning, found his mother on the floor.
Mm.
She fell after the caregiver left on Wednesday, was on the floor for a day and a half.
Oh my gosh.
Spent the next 30 days between hospital and in a skilled nursing facility before coming home.
Mm-hmm.
And she came back a different person.
Mm.
So, look, these things happen. We know the data. Less than a third of these people wear those PERS. The adult children, they order them, they want them to wear them, and maybe they order them themselves, but they either forget them or they don't want them on.
Mm-hmm.
So providing a wraparound service is really big. And the other thing that we collaborated with, we did a partnership with a company called Pocket RN.
Mm.
And Pocket RN is literally what it sounds like. It's a nurse in your pocket. We are non-medical, although I don't like that term. I've been on a crusade to call it in-home supportive care services, because that's more descriptive of what we do.
Mm-hmm.
Non-medical tells the world what you're not. It doesn't tell the world what you are.
Mm-hmm.
We know that line. We know where we can go, where we can't go, and we cannot go on the side of clinical.
Mm-hmm.
But we have a nurse in our pocket, and we've been doing this for almost a year now, and we've averted ER visits. We've averted a lot of things as a result of being able to dial up a nurse. So those are just a couple of things that we're doing that are innovative. And then the last one I'll share with you, and I think you and I talked about it a little bit previously, and that is we're doing caring on demand, fractional care in the senior living communities.
Mm-hmm.
Because the cost of care, both for me and the senior living communities, has gone up so high.
Mm-hmm.
And the fact that, we're a 30-year-old company that has established themselves and a great reputation, and I take no credit for it. I give all the credit to the care and the care team that I have. They're the ones that make us great. And we can go into a senior living community and let them know, look, we'll do the care. We're not going to require 4 hours like we typically do, but we can do it by the minute. We choose to do it in 15-minute increments. And by the way, you can do the scheduling, the family can do the scheduling, the individual can do the scheduling. We can use technology. We don't have to use technology.
Mm-hmm.
Uh, as you know, coming from the senior living world, trying to use that analogy you used before, trying to take that square peg and push it down a round hole to tell people, you need to give us 4 hours. And by the way, during COVID, it was 6 to 8 because I couldn't find caregivers to do as little as 4 hours.
Wow.
It's really, really hard
Mm-hmm.
when my fictitious client, Mrs. Abramson, just needs someone to get her up in the morning,
Right.
get her down to the dining hall and get her back, and then do the same thing in the evening. Why 4 hours would be ridiculous.
Mm-hmm.
I don't need someone for that. And then I'm not going to hire someone for 4 hours in the evening. So it's more of a sharing care
Mm-hmm.
in a high density area in a community like that. So I think to really come full circle, we have to reimagine
Mm-hmm.
everything. The world has changed. I mean, seriously, we are literally, as the World Economic Forum, we're in our fourth industrial revolution right now.
Mm-hmm.
And that started in 2019,
Mm-hmm.
right at the time COVID started happening. And it's going to happen all the way up to 2050. And the changes that we're going to experience are going to be more volatile and further reaching than we've ever experienced before.
Mm-hmm.
And then the other thing that's really changed is the democratization of the world. So how are we going to do things differently? And those are the things we have to think about. And I'll leave you with this before your next question. Technology makes things possible. It's humans that make things happen. And people that are working in the senior living world need to know that we need to still stay human with our care support staff, as well as our clients that we're serving and their families.
Mm-hmm. Yeah, for sure. Okay. Thank you for that. Gosh, so much to think about, but I love how you've used technology, and I'm going to say in the back office and, actually with your clients or to serve your clients. So kudos to that. And we're just in an interesting space where the care is never going to be replaced by technology. So let's embrace technology where it makes us better and better able to pay our caregivers and to use them in the ways that are intended. And to your point with that fractional care on demand service, again, playing into that affordability piece, we're actually serving our clients better by giving them exactly what they need, not an antiquated model that we used to use. So I would love you to share. Our primary audience are senior living executives, CEOs, and such. Some will have their own caregivers that they employ, certainly in assisted living and things like that. But in terms of some actually have caregiver services that serve their independent living residents. I think because that business is getting harder and harder to be in. My old provider that I left a couple of years ago, they've decided to discontinue their employment of caregivers to serve their independent living residents and instead have gone with preferred providers and vetting the providers to serve their residents. But what advice do you have for senior living providers who either may have their own employees or may not in terms of employing those caregivers and or partnering with folks like yourself? What should they be looking for and what kinds of partnerships should they be exploring?
Well, I mean, first of all, I think every community has either faced or is presently facing residents that come in with their own caregivers and a lot of private caregivers. And I think it's a challenge that has existed for at least the last 20 to 30 years. And it's hard to overcome. And I will tell you in the 3 communities that we've been successful with the fractional care was to be able to eliminate those folks from coming in. Mm-hmm. Because, look, you can't control who has access because the resident can give them a key fob and they can get in and out. And who knows, what kind of vetting is being done. Now, some of the higher end communities are doing the background checks, are, validating references. Mm-hmm. Can't believe people don't do that anymore. Mm-hmm. I mean,
right.
It's crazy.
Right.
But we're talking about a population that is one of the most vulnerable in our country. Right behind children, to me, it's older adults. It's, the infirmed as well as the disabled population. Mm-hmm. It's a population we need to be mindful of and care for. So, my message to a lot of the senior living communities, I know that this has been a pain point for you forever in terms of the the number of people that are coming inside your community that you have no idea who they are. And you have no idea what they may be doing to your residents. And the scary part is that if something bad happens, it's usually not on that person. It'll end up being on the community.
Right.
And as you or me as the adult child, we're going to be calling that executive director and say, I don't understand how you allowed this to happen. So I think, with the way things are today, and, we are in desperate times. I mean, we are definitely in an economic challenging period, and desperate times, people do desperate things. And I like what your previous employer did. I think it's important for you to vet out your preferred providers. If you're interested in talking about fractional care, I'm happy to have a conversation with you, whether it's me or another home care company that provides it. There's huge benefit to doing that because we're an employer-based agency. And with an employer-based agency, we have standards that we have to follow. You also want to make sure that the agency is not only carrying the professional liability insurance, but workers' comp is a big deal. And if I could just take a moment and explain this to people, because people think, and for our senior living community that's listening in, and you are having a conversation with one of your residents and they're hell-bent on having their private caregiver, ask them, what happens when that caregiver gets hurt? And there's just something about water, soap, and skin and bathroom tile that's a recipe for disaster. And I can't begin to tell you how many caregivers in my 20 years that got injured. And if one of those caregivers that you are hiring privately gets injured in your residence, I can promise you that your apartment, your homeowners, whatever it is, the insurance you have that you may have bought that rider on it, to protect you, that claims agent is not going to pay you when they find out that that was the person you employed.
Right.
And that's on you.
Right.
That's on you. So knowing a home care agency like ours has that protection. So an employer-based home care agency has that. And guess what else we have to pay for? And it's really expensive. And that is non-owned auto insurance. And what does that mean? 98% of the time we're driving our clients' cars. They don't want to get in our caregivers' cars. And if there's an accident and that happens during an employer-based agency's caregiver's time, that's on me. I have an insurance for that. Your insurance company is going to come to me first, knowing that caregiver. And guess what? I pay enough money. I'm happy to pay that claim. Knock on wood, in my 20 years, I've not had a claim that I've had to pay for auto or theft or anything like that. We've always been able to avert that, but it's really due to the team. I mean, it's the culture that we built, the managers that I have, and really the caregivers that we hire. So my wisdom that I want to impart to the senior living community is that be careful. I love what your previous employer did. I mean, I think you should vet out home care agencies. I think you need to really move on these private caregivers, get them out. I think it gives you a really high exposure. If you're interested in the fractional care model, I think it's the model that will serve this population well today. I don't know about tomorrow, but today I think it fits.
Yeah. Yes. Oh, great advice. Great advice. Lots to think about from this episode, Bob. And we've covered a lot of ground. We've talked about trends and promising practices in terms of recruitment, retention, innovative practices that you're undertaking and that other home care agencies are, how technology assists in that. So thank you so much for sharing your guidance and your advice with us. I love.
So can I leave you with a thought?
Yes.
We are in an exciting time to be alive right now. The changes that we're going to see in our lifetime are going to occur at a pace like nothing we've ever seen before. And, for me, I want our listeners, the people that are watching this, to not walk away from this and feeling like down in the doldrums. We got these headwinds, workforce, we got the prices. It just looks so doom and gloom. But for me, I see opportunity. I'm excited about this workforce automation that we can do, that we can be more intentional with the people that we serve. We need to collaborate and we need to work together. And working together with my senior living partners is the only way we're going to get through this.
Yeah.
We cannot be siloed. It is a collaborative effort, and I'm really happy to be on your show.
Oh, thank you so much. Bob, tell folks how they can get a hold of you. What's the best way?
Well, the best way is, first of all, I love talking about my work. So if you want to catch me via email, you can catch me on, or should I say my email address, and that's Bob Roth, BOBROTH, at cypresshomecare.com. You can check our website out at cypresshomecare.com. I encourage you to link into me. I think LinkedIn is a powerful tool. Jennifer, you do a great job of it. I don't see it like a Facebook. It really is. It's a place where I learn a lot. So link into me, and it's at linkedin.com. My name is Bob Roth, CHS. So it's linkedin.com/IN/BOBROTHCHS and / and you can get to me by LinkedIn. Definitely link into me.
Thank you. We will put all of those links in the show notes so that folks can connect to Bob. He's a great thinker. So I know we've talked a lot about Arizona-specific dynamics, and of course we're based in the Phoenix area, but I'm sure Bob would be willing to share his wisdom with you if you wanted to brainstorm any of your challenges in other states as well. I'm Jennifer Drago, and you've been listening to Senior Living Visionaries podcast, where we explore the cutting-edge ideas and breakthroughs that are shaping the future of our industry. Please subscribe to be notified each time an episode drops at seniorlivingvisionaries.com. Thanks for listening, and we'll see you next time.
You've been listening to the Senior Living Visionaries podcast and radio show, where we showcase the leaders and innovators in the industry who are pushing the boundaries and setting the stage for the future in senior living and services. Join us next time as we share the bold ideas and breakthroughs of the industry's most forward-thinking leaders here on Senior Living Visionaries.